Aviv's Rehabilitation Hospital has 125 inpatient beds, and that's 15% of the total rehab beds in Israel. You also treat 1/3 of Israel's outpatient rehabilitation patients. I think that when people hear rehabilitative medicine, they tend to think about recovery from a stroke or elder care, and I think that this war has turned that on its head. We've seen so many young people injured during their service during October 7th, and many of them have required extensive rehab care, including some have lost limbs and had to kind of learn to deal with that. Can you tell me about the impact of October 7th on your work?
Yes, unfortunately, a few of the previous speakers gave the relevant examples. Just saw Eyal, who recovered at Reut. This is one example of us treating and giving rehabilitation to the ones who are suffering directly from the war, rather than soldiers who we give treatment to. We also have an immense increase of demand from women who suffer from eating disorders. This is something that is also increasing, unfortunately, the last 7 months in Israel.
Is that just due to the increased pressure of the war?
Exactly. Unfortunately, again, we have many patients who recovered. You never really recover, but came back to the community and came back now to the hospital to receive treatment. Another example is pain. We have one of the leading pain clinics at the Reut Rehabilitation Hospital in Tel Aviv, and unfortunately, many cases of pain syndromes are, again, recovering within the patients. One example is a patient who her son is actually now captive in Gaza, and we are trying to give some relief to her pain on a day-to-day treatments.
Wow. Your staff members are going through the same triggers. They're also experiencing this war. How are they handling the emotional complexity, and how are you supporting them in doing this?
The toll on our staff is very high. We have dozens of staffers that were drafted to reserve duties. Me, myself, are still balancing between work and reserve duty as an officer in the IDF, so it's been difficult. We have many spouses of reservists who try to manage between the work life and home. We gave a lot of support. We delivered a lot of efforts from our part to try and give them help. But the main issue is the fact that rehabilitation in Israel is suffering from a severe lack of and shortage of beds, of rehabilitation beds. And we have started in the last few years a negotiation with the Tel Aviv municipality to try and allocate a new lot of land that would help us build a new facility, a new campus for our hospital that will allow us to increase those beds. When we speak about a shortage, we need to understand that you have a simulation, a demonstration of the new campus that is going to be built in the northern part of Tel Aviv, the former Sde Dov, for those of you who remember when you flew out to Eilat. So the municipality kindly allocated this lot of land as a partner, understanding that this is the future of rehabilitation and the future hospital of Tel Aviv. So you can see here a demonstration that will allow us to increase the beds from 350 today to 450 in the first phase, and up to 600 in the second phase, to increase the services, both inpatient and outpatient services that we provide to our patients, bringing in other services as well, and to allow our staff also the adequate workspace for these efforts.
Thank you so much.
Thank you for hosting us.